Hi, my name's Oliver Donaldson. I'm an orthopaedic consultant at Yeovil District Hospital, and I'm also a member of the board for OTSIS. I've got Emily Borhan here with me today, who's our medical legal advisor for OTSIS, and we've come together today really to talk about consent. So welcome, Emily. Thanks for joining us.
Hi.
So what I'm going to do, I'm just interested just to understand from your perspective in the medical legal world, how often consent is considered a significant issue when you come to litigation?
Yeah, it's a really interesting question, actually, because I mean, everyone knows that consent is relevant for all treatment that you carry out on patients. And I think it's quite clear that as a legal point, it's quite a main point, but the statistics aren't that widely available. And so it's not something that's actually looked into in that much detail, although everyone knows how important it is. But there was a fairly recent study at the Queen Mary University Hospital, and they looked at sort of cases overall, and although the increase in sort of the variety of other types of cases was fairly steady, the increase in consent cases had actually increased fourfold nearly, and actually specifically where there was a contributory factor of a lack of informed consent, it's actually increased nearly tenfold, which is quite a lot. They also looked at a group of cases overall from a period of time, it was 2005 to 2019, and out of the 70,000 cases that were reported, 2,300 were actually linked to a failure to inform correctly. And I think the total amount on that was £400 million that the cases amounted to. So it is something that we can see is clearly on the increase, and it is quite a major part of the litigation process.
Okay, so that's obviously slightly rather concerning. Obviously, it's a major part of what we do as orthopaedic consultants. So from our perspective, we feel that we understand what a valid consent process is, but do you mind just from your perspective, just going through what you think constitutes valid consent?
Yeah, sure. So for consent to be valid, it has to be voluntary. So that means that the patient has to make that decision themselves. There can't be any pressure from family, from relatives, from friends, or even from any medical professional, whether that's nursing staff or anyone. It has to be their decision. They have to be in the right capacity. So they have to be capable of making the decision themselves. They have to be able to take in the information and understand the information that they've been given. And it has to be informed. And this is the bit that's quite new and quite recent. I'm sure probably a lot of you have heard of the Montgomery case. That made significant changes to the law, and that basically emphasised that as a medical professional, for informed consent to be valid, the patient needs to be aware of all the risks and benefits involved in the procedure. They need to have reasonable knowledge of any alternative options for them, and they need to have an idea of what will happen if it doesn't go ahead. And in order for them to be fully informed of the situation, all of these points need to be valid for them to be able to understand and make the decision on their own, and come to that conclusion as to whether they want to proceed with medical treatment or not, based on the information that you've provided to them about the treatment.
Okay, so when we, so in our NHS practice, it's fairly common now in our NHS practice to have a consenting clinic, where nearer the time, because we've had a long wait for a waiting list, potentially nearer the time we'll see the patient again to see them purely to consent the patient. But in the private in private practice, sometimes that wait isn't that long. We may be concerned as to whether we might be remunerated in an appropriate manner from insurance companies if we had another outpatient episode for consent. And so I suppose the question is really, how many patient episodes, how many patient appointments are required to get valid consent?
Yeah, I know on the NHS that in the bringing in of the new sort of appointment is quite a new thing, isn't it? Which I think is quite useful, because it is quite difficult to get the timing absolutely right. I mean, in terms of numbers of appointments, it would be quite hard to put an exact number on it, because a lot of the time it will actually depend on, one, the treatment that's being carried out, and also the patient, because you have to keep in mind here, it's about, the key element here is that the person has understood what is the information that they've been provided. So it might, for a certain patient, it might be that they need an extra consultation because they've got so many questions, or they're not sure about something. And so it really, the exact number is hard to put down. Although, I mean, on the flip side, I think it would be hard to achieve all the things that you need to achieve in, say, one consultation. So if you think of seeing the patient, one time prior to surgery, do you really have enough time to go over all the information, to make sure that they've understood all the information, and then to also make sure that you, as the medical professional, you feel comfortable that the patient has understood it? Because that's also quite an important key, is you need to make sure that you feel comfortable that the patient has taken away that information and understand what they've been told. And I think to achieve all of that in, say, one consultation prior to surgery, one could say is probably unrealistic. So it's really a case of the whole process along the way, rather than saying, okay, well, there should be X amount of consultations for every person that you see.
And if you look at, I mean, obviously there's a huge amount of information regarding consent, which you can find on the internet. And the Royal College of Surgeons also gives quite a lot of information about that. And one of their points regarding consent, I'm just going to read out to you, because I think it is something which is pertinent to us, and it relates to whether consent on the day of surgery is acceptable. So as part of the Royal College of Surgeons guidance, they've written that a patient signs a consent form at the end of the consent discussion, allowing the patient to take a copy for reference and reflection on the day of the procedure. That is then checked with the patient, and if anything has changed, to see if anything has changed since consent discussion. So, the Royal College of Surgeons is saying that sort of on the day of surgery, consenting a patient is probably not acceptable practice. That's my interpretation of that, but I was just wondering if you had any thoughts.
Yeah, I agree, actually. I think, traditionally it was always, that was how it worked, wasn't it? You go in, especially in the NHS, you'd go in for your procedure in the morning, some person, or afternoon, someone would come round, here's your consent form, sign it, and off you go. And actually, it's not the best approach, because things, just before a procedure, you've got to keep in mind what the patient's probably feeling. They're a bit anxious. It can often be a bit rushed, where you're trying to get through all of the theatres of that day. They also haven't had time to really take in the amount of information. So although things were probably discussed in the consultation prior to the surgery, the actual consent form there is where most of the information is going to be given to them. And they haven't really had that much time to read it, take it in. So I think doing it on the day is just not allowing enough time for the actual informed part of the consent to have been successful or completed. That being said, obviously you don't really want to do it too far ahead either, because if let's say you do that extra consultation where you bring them in and they sign the form and you go over it, if the procedure is then 6 weeks later, there could be arguments there that maybe things have changed in the 6 weeks, maybe they've felt slightly different. So you want to get that balance of not on the day, ideally, if you can get away with it, and not too far ahead that it's not fresh. Obviously, with either of these, if you don't do it on the day of surgery, you would need to do a sort of a refresh on the day of surgery. So go and see them, make sure that they still understand. Is everything okay? Do you have any further questions? Are you aware of everything that's going to take place? Just so you know that they're okay on the day, that nothing's changed. From a legal perspective, it is quite interesting that when it actually comes down to it with a lot of cases, they're not just looking at when the form was signed. Likewise, they're not just looking at the consent form. They're looking at that whole process from the first time that you see that patient right to the end. So it sort of, eases that argument a bit, in the sense that is the perfect procedure, is doing it, more than not of the morning or the day of the surgery and giving it a bit of time. But the whole process is what they look at. So from the moment you first see that patient and you're discussing things with that patient right up until the point that you finish the procedure is what they're going to look at for the consent process, which is why it's important to make sure that the patient is informed from the start, really. So it's not just looking at that signed consent form, it's looking at what you've discussed with the patient from the start.
Okay, and I mean, we've got lots of different procedures within orthopedics, some which are, highly complex, revision hip surgery, revision knee surgery, in terms of knee arthroplasty. But we've also got some simple cases, so knee arthroscopy, carpal tunnel releases and things. I mean, do you think we should have different processes for different procedures in terms of how we perceive them, how we perceive the complexity to be?
Yeah, I think, again, it's quite an interesting one. I mean, to some degree, the answer to this is going to be yes, in the sense that, a procedure that carries more risks or a procedure that's much more complicated is going to take a longer process to make sure the patient is fully aware of what's going on. They understand the risks, especially if those risks are quite great and severe to the quality of their life and things like that. So yeah, to some degree, yes, but on the flip side, no matter how minor the procedure is, the patient still has to consent to have that procedure, or for any treatment, they have to consent. And in order to consent, they have to be informed. So your actual process of what you need to do with the patient, in a sense that, they need to be fully informed, you need to tell them all the risks, the benefits, and, other alternative things and procedures that can happen. That same process should be the same whatever you're doing, because in order for any treatment to go ahead, the patient has to consent. So the process itself remains the same, and you need to make sure that every patient is consenting to what they're having. But obviously some procedures might have to go into more detail than others, purely because of the complexity of the nature of the procedure.
So, and just following on from what you said there, I suppose then, obviously every patient interaction doesn't have to be a face-to-face interaction. So perhaps actually in those lesser procedures, for example, you might decide a telephone consultation might be an appropriate next step just to help with that consenting process. Would that be reasonable?
Yeah, I think as long as the patient has had some form of documentation or something that they can take away with them, or if they've had an opportunity to see you at some point before the procedure would be quite appropriate. But certainly to have that extra, putting in a telephone conversation is fine, as long as you then obviously note it and record it in some way in the medical notes.
Yeah, so going on to that, how you record it and things, I mean, I think it's important if you could just tell us what you feel in what way we should be documenting the consent discussion. I mean, is it reasonable to have a template consent letter which we send out to patients if we're doing similar procedures, or do we need to personalize it more?
Yeah, so I like this question, because from my point of view, from the legal side, getting the consent is obviously the most important part, and informing the patient is obviously the most important part. But just as important is the documentation of it, because if you don't have that documented, it, later on down the line, hopefully it wouldn't happen, but if it did occur and it goes down the legal route, it's sort of, if it's not documented, it's like it hasn't occurred. And then it's going to be harder to prove and to use in litigation that you took that process. So for me, the documenting part is just as important as actually doing it, because you need to make sure that it's done. In terms of how to do it and what you have, I like to sort of have two elements here. A leaflet or a template or something like that is a great starting point, and that's because mainly because you've got it there. It would have been pre-done, so you've managed to go through it and make sure everything's detailed, and it's sort of like that backup, really, that you've got all the information there. You don't need to think about it on the spot. It's there. The patient can take it away with them, so they can read it in their own time and use that time to actually think about what's going on. And that's really quite useful, because it's sort of like your safety net as such. But at the same time, you need to also have the handwritten notes, and those will be based on what you've discussed in a consultation. Obviously now at the moment with Zoom and things, it's slightly different. I'm not sure how you're doing sort of diagrams over a camera or something. I don't know, but certainly the written the written notes are just as important, and do, you know, if it's possible, depending on what procedure it is, do those you know, diagrams and things that you can show them in the consultation, and make sure that's all saved in the clinical notes. And the reason for that is because the notes that you have on the clinical file that you're doing in front of them shows more of what you're doing with the patient directly. So it's giving that written sort of summary as such of what you're saying to them, what you've discussed, what you've shown them. You might include there, maybe if they've asked a specific question, you can jot down maybe a question that they asked, and, you know, in note take, obviously, roughly what you've explained to them. And that makes it a bit more personal to the patient, because obviously every patient you see is slightly different. Some people are going to have concerns of different areas, and you know, the treatment for each patient will be different. And doing it based on the clinical notes will make it more personal to them. So you've gone out of your way to make sure that the patient has been informed for their particular need, and that they understand what the information is. The only, you know, downside to the leaflets and things like that, or the consent template, is that you can give a leaflet and, you know, give a diagram, whatever it is, the consent template. But if you're just dumping a load of information on the patient, they're getting the information, but you're not necessarily 100% sure that they've understood it or understand what's going to take place, and if they have any further questions. So putting the two together creates quite a safe situation, in the sense that you've got your templates, you've got your leaflets, which provide, you know, most of the information, if all the information that they need. They can take it away, they can think about it. But on adjacent to that, you've got your handwritten notes, which are documenting what you're discussing with that particular patient about their particular treatment, and covering any questions that they might have. And that really covers you from both sides.
Okay, so I mean, in summary, then, from what you've told me today as a working orthopedic consultant, I think in my practice, I feel that one patient episode, but seeing a patient and then offering an operation and consenting that patient the day is probably not good practice. We need to have another episode in between. And so what I do myself nowadays is I will see a patient, and I'll give them information at that time for the procedure that they're going to have, and then depending on the complexity of that operation, I'll decide as to whether I need to see them face to face, or whether a telephone consultation is satisfactory. What I'm not doing at the moment is documenting that next consultation as clearly as I should do, in terms of personalizing it, as you say. But we do discuss what they have read and whether they have any questions. But I feel that documenting that discussion is probably the bit which we, as orthopedic consultants, may fall down on quite a bit.
Yeah, and I mean, you know, it's very easy for me to sit here and tell you, but in reality, I know there's time issues. You're in the moment, you're talking to them. You know, I see a lot of notes where most of the time I can't even read it, and that's the other issue. You can document it all you like, but if somebody else can't read it, it's then sort of, you know, doesn't become very useful either for you later on down the line. But, you know, again, it's all easier said than done. I think that's the perfect situation, what you described, and there you're sort of covered as much as you possibly can be, to help you in case something comes out. But ultimately, a clinic letter that you've sent to them after a consultation explaining that they've understood the majority of it would be fine. If you haven't got handwritten notes all over the place, you're not necessarily going to really suffer without that. It's just that's the best case scenario. Anything around that, it's still useful.
Okay. Thank you, Emily. That's been really interesting, actually informative for me, and certainly, hopefully, it will be informative for the rest of our members as well. So thank you for your time.
No worries at all. Thanks a lot.
Okay, thanks then.